Today on The Explainer, we're looking at a serious back injury that often gets missed in young athletes. So, what if that nagging back pain your young athlete has isn't just a simple pulled muscle?
It usually starts as a dull, aching pain that really flares up with activity, like arching the back.
This is really common in sports with a ton of repetitive back bending and twisting. And get this, in some of these sports, it affects up to a staggering 60% of young athletes. So, what's actually going on here? Well, the culprit is often something called spondylolysis. Think of it like this. You bend a paperclip back and forth and it cracks. Same idea here. It mostly hits teenage athletes, usually between 10 and 15, and it's twice as common in boys. And here's the kicker. Catching it early is absolutely key, but it's proving to be a huge challenge. Check out this crazy gap in diagnosis time. With an orthopedist, it's 1 week. Without, 25. Pain starts, but it can take 24 weeks just to see a doctor, and another 15 for a final diagnosis. And this delay really matters. It can lead to much more severe complications down the road. Okay, but here's the good news. Once it's diagnosed, conservative treatment works incredibly well. The treatment path is pretty straightforward. Rest, physical therapy, and sometimes a brace for support. But to brace or not to brace, that's actually a big debate, with no clear long-term benefit proven. And you know what? Surgery is pretty rare. The vast majority of these athletes recover without it. So even though treatment works, there are still some big questions researchers are trying to figure out. Yeah, they're digging into things like NSAIDs, bracing, and how to prevent this from even happening. And there's some really cool stuff on the horizon, like ultrasound screening and wearable tech. So the real question is, how do we close that huge 24-week diagnostic gap for these kids?